Frank Pega from the World Health Organization, who was part of the research team. He's joining us from Geneva. Frank, thanks very much for being with us here on the NewsHour. Now, just take us through the methodology, please. How did you come up with 750,000 people dying in 2016?
Thank you very much. So we had 2,300 surveys that were collected in 154 countries from around the world, from which we could find out, estimate how many people per country were exposed to working long working hours, which we defined as 55 hours per week. And then we also had scientists from around the world, 40 leading scientists, collect information on how much more these people who worked long working hours were likely to die from cardiovascular disease, from stroke, from ischemic heart disease. And these pieces of the puzzle we could put together to then estimate the number of people who would die as a result of working long hours.
Are we talking about specific industries here, Mr. Pega?
We're not. Indeed, we're talking about data from any industry and across all industries here. So these were global data. Several 10 million people provided information on this that was used then to calculate this burden of disease.
I mean, the stereotype is the banker working 80 hours and earning hundreds of thousands, if not millions, a year. It's not just bankers, though, is it? It's everyone who works over hours per week.
Correct. We did a number of analyses to see if we could find in the data differences by occupation or by industrial sector. And indeed, there was no information to that end. We found that the risks seemed to be increased equally across all occupational and industrial sectors. And as far as we do have information and evidence to that effect.
I wonder about manual labour sectors. Was there a higher proportion of people within those industries who are getting sick from overwork?
I think it's fair to say that from our data, we can see that everybody who works long working hours across sectors, across sexes, across regions, there was no indication in the evidence that there were differences. What we did find, though, when we crunched the numbers and we provided the estimates themselves, that there's a disproportionately large burden in the end carried by males. So 72%, for example, of all death attributable to long working hours occur amongst males. And we also had disproportionately many people die in the Western Pacific region and in Southeast Asia. And this might be, if you ask yourself why that is the case, this might be due to a large proportion of the workforce being in the informal economy, where people might be having to work long hours in order to survive.
So it leaves the question then, what is to be done? Is it about employers respecting their workers more? Is it about workers taking more control of what they're actually doing? Where do we go from here?
We provide 4 recommendations. First, we need to agree on maximum limits on working hours. Right? And one good example is the working hour directive of the European Union, where we know that numbers of hours of work per week are limited to 48. And we see in our estimates that this comes through with low proportions of people working long hours there, and as a result, a relatively low burden compared to other regions. Second, we need to provide better working time arrangements so we can regulate overtime. We can make sure that shift work and nighttime shifts are used appropriately, and also flexi time. And then also to be clear on the people who work in the informal economy, we need to provide coverage with social protection floors. So when people do not have to be working poor, so if they can get an income, a basic income or a social protection floor, then they're not forced to work long hours. Finally, 4th recommendation is basic occupational health services for everybody.
Okay, we'll have to leave it there. Frank Pega from the World Health Organization. Don't work too hard or too long, but thanks for being with us.